If I had just one visit with someone, what's the most important thing that I want them to walk away with? And that should be at the forefront of every engagement that we have with someone, is how can I make a difference in their life? And that's going to really result in lifelong change for them. Cecelia Health is a virtual specialty medical practice where we deliver integrated cardiometabolic care for individuals living with chronic diseases. When you think about integrated care delivery, first and foremost, you need to think about lifestyle. So what impacts these disease states the most? It's our lifestyle. It's how we're sleeping, how we're eating, how active are we? Are we taking our medication? Are there devices such as a blood pressure monitor and blood glucose meter that we're utilizing? Everything is a behavior in our life. You have to target one thing at a time and build on that. You can't expect someone to come to the table and just change everything all at one time. You're going to lose that individual. It's overwhelming. It's a little bit too much to take on. So when an integrated care approach, you have that model in place, you have to prioritize what's needed the most. Moving from diabetes to more of an integrated cardiometabolic model at Cecelia Health was a natural evolution as you start to look at that whole person. And unfortunately, most individuals are dealing with more than one chronic condition. So when we think about that, even more so now as you think about medications such as GLP-1s, you're not just focusing on diabetes or just focusing on weight management. You may be focusing on another chronic disease associated with that medication. So you have to, again, think about the whole person and take that medication, which is, it's a treatment, it's a tool, it's a treatment. How do you incorporate that into their lifestyle? Because it is a behavior, but you can't just do that alone. You have to take that medication and you have to pair it with, again, all those aspects of your life: stress management, sleep quality, how are you eating, what's feasible to you, what are your meal patterns, how do you bring all that together with that medication is crucial to understand how to do that. When you think about integrated care, especially in the virtual setting, that's the beauty of virtual integrated care, is that you can extend your reach, and it's extensible to any disease state that somebody is managing day to day. So by extending your reach, you can incorporate an expert clinician and a provider in a virtual setting and have it be the right time, the right place for that individual. We think about this as more a partnership or an extension of their external care team that they have. We're doing the education, we're connecting the dots for that individual. And that's what's motivating, is to take a clinician and to be able to help you connect the dots and say, because you shared this with me, we're now working on this. Look at what's happening. Look at how your numbers are improving. Look at how you feel better. You're more confident. You're sleeping better. You feel now that you are able to care for your mom better because you feel better.